2020.
Hello and welcome to this special edition COVID-19 program dedicated to discussing the pandemic and our community resources. My name is Carol Merton, and before I welcome our first guest, I want to extend a most sincere and heartfelt thank you to our Medical Officer of Health, our Public Health Unit staff, our community service providers and our agencies, our first responders, our hospitals, retirement homes, long-term care facilities, our essential frontline staff that would include grocery stores, pharmacies, delivery truck drivers, gas station attendants, and so very more. I want to thank you for your efforts, your ongoing efforts to keep our community safe. We are all together in this exceptional and ever-changing situation, and we are all neighbors doing our very best to support and care for each other. Here at Rogers TV, we will be providing you with current information from our community agencies and our elected officials. However, as you're probably already aware, this information changes rapidly, sometimes hourly, sometimes daily. What we want to do is encourage you to stay as current as possible with this information by going on to the Public Health Unit website at publichealthgraybruce.on.ca, listen to the radio, read your daily newspaper, and of course, tune into Rogers TV for information. Today, I am delighted to welcome back as a guest James Sconganck from Bruce Power, and James' official title is Executive Vice President, Corporate Affairs and Operational Services. James, thank you again for being on the program. I know you have lots of information to share with us.
Yeah, it's great to be back. Thanks for having me.
My pleasure. Now, I know it's only been about a week since you and I chatted, and I have a list of things that Bruce Power I know has been doing, and I'm wondering if I can just turn it over to you and ask for an update on the response and what Bruce Power has been doing regarding supporting our community.
Yeah, definitely. Happy to do that. And it's hard to believe. It seems like a year ago we were together. It just goes to show you how much in a situation like a pandemic, how much happens from day to day and week to week. So, as you noted, the public health officials are just doing a fantastic job in Grey and Bruce counties under Dr. Era's leadership, working with the hospital leadership at the three various hospitals, whether that's Hanover, South Bruce Grey, or Grey Bruce Health Services. And no doubt our counties and municipalities are also playing an important role with that. And I say that because that's really what's driving a lot of our activities. Is most of what we're doing is connected to and linked with them and supporting their response in any way we can. I would say a few key items to note. Maybe I'll start locally first and foremost. The later part of last week, actually after the conversation that we had, we did hold a similar telephone town hall as far south as Huron County. And again, got really good engagement. And a key that was really important going into the Easter long weekend, where public health officials really needed to ensure they got a strong message out to the public. And recognizing that Easter is a time when people tend to get together, travel, and so I think a lot of the precautions that everybody thought were really important to take in Easter, it was really important to get those messages out. So we had a telephone town hall in Huron County following the Bruce and Grey one last week. We also deployed a technology to make automated telephone calls to every household that had a landline in Grey Bruce and Huron counties. And so what that was really intended to do was to provide the medical officers of health and the wardens of the county an opportunity to get a key message out to people. We assume that people have access to forums like this, Facebook, social media, but there's a lot of individuals that are still not online, and they rely on getting their information through what they receive in the mail, traditional landlines or radio. And that was why from the perspective of our telephone town halls, covering those on both the AM and FM stations was really important because a lot of folks still tune in. It's one of the most reliable ways to still get information out.
Mm-hmm.
Outside of the region more broadly, last week we launched a 60-second television spot. I'm not sure if you had a chance to see it yet. I can share it, but it's a very compelling, emotional television spot where what we did was redirected what would normally be our corporate advertising and advocacy work and redirected it to a message of coming together, supporting our public health officials and staying home. And I think that was an important TV message that's running across Ontario over the course of the next couple of weeks. And then we announced yesterday, which was Tuesday, we talked in our last session about our medical grade cobalt that we harvest at the Bruce site. So we announced yesterday that has been processed at Ottawa-based Nordion and is now being shipped around the world. And of course, that medical grade cobalt is what is used to sterilize masks, gowns, gloves, face shields, things that medical professionals are using all over the world. And that's obviously important that material makes it to the countries that are manufacturing some of this material. So after they're done manufacturing it, they can sterilize it.
Excellent. And I think that's an important point because you're sharing the cobalt, you're sending it across the world, really, not just locally. And I think that's the form of outreach that we want to celebrate and also acknowledge it's necessary. This is a worldwide concern, and anything we can do to help is excellent. So that certainly we had discussed cobalt, but now that you're definitely in the process of distributing that, from what I understand.
Yeah, that's right. And it's really important the world can count on that supply. So especially as you're seeing higher volumes of medical equipment get manufactured, it all needs to be sterilized. And there's a number of ways you can sterilize medical equipment. Sterilize really means that you're making sure it's clean. So when a physician or a frontline healthcare worker uses a mask or opens up a bandage of some kind or anything that's packaged single use, they want to make sure it's sterilized. So one of the most effective ways to sterilize medical equipment is using the process of irradiation. So we supply that, and it's really exciting. And Canada overall provides about 2/3 or 70% of the world's isotopes that are needed to do that, and a majority of that comes from Bruce County.
Excellent. Now I do have my list in front of me, but did you want to continue on, or do you want me to ask you?
No, go ahead. Feel free to go ahead. I want to make sure we cover everything that you'd like to cover today.
Well, you're the one with the content expertise. I just want you to know I did my homework.
Oh, of course, I had no doubt of that.
So a few things. Can you talk a little bit about the appreciation baskets that you sent out?
Yeah, so definitely. So, I think one of the things that we're all very grateful for, and you talked about this at the start of your program, is the work of our frontline healthcare workers. So, we've done what a lot of other organizations in the community have done, and really to recognize our frontline healthcare workers in the area. One of the initiatives that we rolled out just before the Easter long weekend and announced it yesterday, it'll be complete within about 7-8 days from now, is we worked with local businesses throughout the area. We kind of have two problems that what we tried to do was turn into a solution. So we have local businesses that, in some cases, like the grocery stores and whatnot, they're still moving a lot of product because they're busy, but there's a lot of local businesses that just aren't moving the same volumes of what they normally would, but have access to essential things people need. But this is a tough time for small businesses. And then we have people in the community, whether they're seniors, other folks who can't make it to a food bank, who need access to a lot of necessities. So working with local businesses, what we did was purchased enough material for 2,000 what we're calling care packages, some things folks need. And so what that does is it puts some money into the pocket of local businesses, which they need, and they're really critical to our economy, and we want them to all be here when COVID is over, and they play absolutely a vital role in the community. But also, while we're putting some money into the pockets of local businesses, we're providing care packages for folks who need it. So by this time next week, we'll have all 2,000 of those out. And it's really exciting that we're able to help folks with that. And, in addition to the work that everybody is trying to do to support food banks at this time.
Excellent. Now, I also had about sanitizer, about making hand sanitizer and distributing it. So could you speak a bit about that, please, James?
Yeah, for sure. So obviously hand sanitizer is in high demand right now. If you go to any store, it's impossible to buy hand sanitizer. And we know that the priority for hand sanitizer is the hospitals, and the hospitals purchase a certain grade of hand sanitizer that's kind of coordinated through the province and their supply chain. But if you go back to the advice that health professionals continue to give us, in addition to physical distancing and staying at home, they always talk about washing our hands and keeping them clean. And so that can be washing with soap and water, but it can also be using hand sanitizer. And so we will be announcing later this week an initiative where we've been able to source large volumes of hand sanitizer that's being produced within the region, that we will be, with a number of other sponsors, donating to areas that don't have access to it, whether that's food banks, other community needs. Again, keeping your hands clean is really important. So we'll be announcing that later this week. And we're also working with a provider who, don't want to say any names till we announce it formally,
right,
but has a brewery right now, and seeing what we can do to work with them over the course of the next couple of months, recognizing that COVID to some degree or another is going to be here for some time. We don't know to what level, but we do know there's going to be a large demand for hand sanitizer for a long period of time here. And so we're going to work with one provider here locally to see how can they retool their business, go through the approvals needed, whether that's Health Canada, whether it's other licenses, so we can make that hand sanitizer even more local than the regional approach we're taking to buy it. But the goal is, step one is procure a lot of hand sanitizer and make it available to people right away over the next, between now and the end of the month, and then work with an additional provider to get more local capacity that could be, made available at a fairly affordable and ongoing rate.
Excellent. So not only are you planning action for now, but you're definitely planning for ahead, because the most recent news, of course, is that COVID-19 and the declaration of emergency is going on longer for sure. So being prepared for the future is critical. So a few more things on my list. iPads for long-term care facilities. Can you speak a little bit about that, James, please?
Yeah, so one of the areas that I think we all are probably have the highest degree of concern on is the situation in long-term care facilities. So if you look at where we're seeing some of the tragic news of deaths, whether it's in Ontario or Quebec, you're seeing long-term care facilities are a challenge. And you saw the province announce yesterday an initiative to really focus on long-term care facilities. And, it makes kind of common sense why it could be there, because you have a concentrated number of what would be vulnerable population living there. And so, the introduction of COVID in a facility like that can be very dangerous. And so I think we're all trying as citizens to do our best to, know if we have loved ones in a long-term care facility, unfortunately, going and visiting them is not the right thing to do, even though you would really like to see them. And you can see the province is putting in a lot of measures to make sure long-term care homes are protected. What we have done is recognize that families still want to be able to communicate with the loved ones in long-term care homes, and that component of their mental health is really important. A lot of long-term care homes are using iPads and and technology like that in addition to the phone. So just like you and I talking, you can see a face and put a face to a name. And so we have distributed, they'll be arriving, if they haven't arrived already today, it will be imminent, additional iPads to those facilities. So those facilities can connect them to their Wi-Fi, and we don't have enough to give to every resident, but that every half an hour somebody can use it, of course, with the proper sterilization in between uses. So family members can, if they're not already, have that capability, that they would be able to have a face-to-face, a FaceTime conversation, and to be able to keep in touch. Because I think, it's particularly scary for those folks if they're used to a visitor once a week or twice a week. All of a sudden you've cut that off, and that can be pretty scary. So it's a small thing we can do to help with that.
You say it's a small thing, but I think it's a big thing. Having worked in long-term care facilities myself, and also knowing people who have parents in long-term care, having that connection is critical, because it's a worrisome time, and being able to at least visually see their parent, I think, really helps with the anxiety. Certainly. So I commend you for that. I think it's a good thing to be able to help people stay connected. What about surge beds? I understand you've been actively involved in that as well. Can you explain what that is?
Yeah, so absolutely. So surge beds are, just by way of background, what we mean by surge beds. So obviously, if you sort of take a step through what the medical officer of health and what the hospitals have done in response to the pandemic, the first thing they've done is obviously reduce the number of people going to hospital. So, if you don't need to go to the hospital, don't go to a hospital. And you're seeing that with emergency rooms and minimizing things like elective surgeries. Now, you may have seen an announcement out this week from the Heart and Stroke Foundation where they said that does not mean don't go to an emergency room if you have a chest pain or something like that. And I think that's also an important message to look at what the Heart and Stroke Foundation said as well. But really what healthcare has done is they've got themselves set up so if there is a surge in the need to respond to COVID cases, that their facilities are ready for that. What we've seen in some jurisdictions, whether it's Italy, New York, obviously China, is that the existing healthcare infrastructure was not fully, did not have the full capacity to deal with that. So there were not as many beds as there were patients. Now, when you think of hospital beds, and you can talk to our hospital CEOs about this, they would explain this better than I can. But when you think of a hospital bed, there's really three components to that. The first component is the hospital bed. Second component is equipment. And third component, and most importantly, is the healthcare professionals that can service that. So what we recognized was there could be a need for surge capacity in the area. Grey Bruce Health Services, on their own initiative, went and is obviously establishing that surge capacity in Owen Sound, and you've seen some of the images there, and Grey Bruce Health Services has gone and done that. And really what that is what they're doing there is creating a capacity, not necessarily even for COVID, but for other things, that if they need that capacity, it's in place. We offered, using our supply chain and logistics capability at Bruce Power, beyond that, to say, does it make sense to go in and proactively put some of these in place when you are in a situation you need it? It's not exactly the right time to be going in sourcing beds and electricity and location and all those logistics, which may seem like minor things, but those are if you're in a situation, you want to have those. So we have supported, working with public health and the counties, 100 surge beds, which are now in place. There will be in place shortly. Dr. Arrow will be making an update on this next week in Hanover and Kincardine. And really what we were doing was using our logistics capability so they didn't have to worry about that. We agreed on what is needed in those locations and how can we work together. We could kind of take off their plate the ordering of material, get that material in, get it set up, get electricity in, get it ready. So if it's needed, it could be turned over. You could have a scenario where we do all this and it's not needed. And if it's not needed, that's a good thing. So all we've done is went and bought a lot of material. It wasn't an inexpensive investment, but if it's not needed, that's a good thing. And we would, at that point, look to, if it's not used, donate it to shelters or other community needs.
One of the key learnings as I'm talking to different organizations and businesses is the importance of supply chain.
Yes.
And my question to you is, all of these initiatives and the use of the supply chain, you must have a team, an idea team that works together. Can you describe a little bit about, I mean, you've described a lot of initiatives, but how do they come to be? Is there a small group of people who come together who talk, or how does that work in your organization?
So the way it works in our organization is, and we're, what is today? So we're about a month into this. So we stood up an organization called the Emergency Management Center. So it's a center that is staffed all day, every day. And it's really, it's an emergency management tool. So you have a commander who's in charge of that. And that commander has access to communications, logistics, all the different supports that he or she needs. And it's really, it's almost treated like a military operation. And then you have Bruce Power's executive team, which is called the crisis management team, that commander reports into. And so what that does is that sets up a command and control structure where you can execute things quickly. You know, so if we were in something like a tornado, we would stand that up and you make decisions quickly, efficiently, and you utilize all that capability. So we decided early in the pandemic to stand up that capability for this. And when you stand that up, you give that emergency management center mandate. What is it we want that emergency management center to focus on? And we really gave that emergency management center 3 things to focus on at Bruce Power. The first was obviously making sure we are carrying out all the safety measures we need on site, reducing numbers, all the things that we've talked about before on site. So that's priority 1. Priority 2 is that we're starting to do planning. So if COVID gets worse, what do we do on site to maintain the reliable supply of electricity? And also, what additional preventative measures can we put in place? And priority 3 is, how do we leverage that organization to meet the community needs? And so those are the 3 priorities that emergency management organization has. And when we have these things, we work with the officials to say, are they helpful? Are they necessary? And we use the emergency management center to go and execute against that quickly. A lot of organizations don't have that kind of scale. You know, if you're running a medium-sized hospital, like let's say Owen Sound as an example, I'm not minimizing what it would take to run a large hospital, but you don't have the same kind of infrastructure as a large hospital, let's say downtown Toronto, or a county organization in Bruce or Grey or Huron. You know, you're not as large. You don't have the same kind of infrastructure as a city of Toronto. So what we've really tried to do is say we have some of that infrastructure available, be it by nature running a large operation like we do, and how do we make some of that available to make their lives easier? Lots of it is actually not necessarily even a financial thing. It's about, you know, how do you execute logistics? How do you place order for things? How do you get access to things? And we're set up to do that. And, you know, it wouldn't be an appropriate response to COVID if we just stayed focused on our site. We have to look at the broader area.
One of the things, the key learnings for me as we go through is the strategic partnerships, but the unique partnerships that are coming together as a result of this, and ways that we probably could never even have imagined in the past. We have a few minutes left, and I have a few more items, but is there anything you haven't covered yet that you really want to emphasize? Because I want to make sure we use this time for you to speak about.
No, I think it's you know, the only thing I would say before we cover off your final items is I think we have to make sure that, you know, it is clear that, and this is a message we're giving to our organization as well. Obviously, I think people are starting to feel positive about the actions that we've taken, and we should all feel positive about that. I think you see from Ontario's Medical Officer of Health some very early signs of some optimism. We need to make sure we don't take our foot off the gas on this, and that we continue to be as resilient as we have been. You know, it's everybody's very keen to get back to normal, but what we do now, just like what we did a few weeks ago collectively, will make a big difference.
Absolutely. I think one of the other things on my list, and you may have mentioned it, but I'm not sure, is that you have an app Grey Bruce, Huron, Perth Strong. Did you want to chat about that?
That's right. So later today, later this afternoon, we'll be announcing the release of an app. If you have an iPhone right now and you go on it, you can download it. It's called Grey Bruce Huron Strong. There'll be a website launch. It'll be on an app. So you go on there. And really what that is it's a way that, and we encourage everybody, if you have an iPhone or an Android device, go in and download the app. By the end of the day today, it'll be available. You can go online and Google it as well. And really what it is, it's to take all of the information that's been provided and really put it at a local level. It has a lot of innovative tools about how you can shop local. We'll obviously be building those elements out. We partnered with a really innovative company called NPX Innovation, who does a lot of technical work for us, and they helped us put this together with the Innovation Institute as well. And there's a lot of great tools on there. It's about how you can recognize a frontline healthcare worker, to where you can get community support, to what cases are in the community that are being published by the medical officer of health, guidance, push notifications. So it's really a one-stop shop where anything you need in Grey Bruce Huron, we can make available on this app. And so, download it, use it. There's an opportunity for you to provide some feedback on what other features you'd like to see, but it's really a one-stop way that people can get access to all that information.
Excellent. Now, I received some information, and I'm wondering if you can speak to it, about community relief efforts for Indigenous peoples and those people who may need assistance along the shoreline. Do you have any comments about that?
Yeah, definitely. So we've kept very close engagement with the First Nations and Métis communities, and our Care Pack program is focused on that. Our food bank donations ensure we covered the First Nations food banks. Our hand sanitizer program will include that. We also have a fairly robust, it's called the Indigenous Community Investment Fund. It's a $200,000 a year fund. $250,000 a year fund that is available for Indigenous communities, and we're working with those Indigenous communities to see how can we release those funds early. Most of it has already been released to direct to urgent needs. We're working closely with the Chiefs and Council of the Saugeen Ojibwe Nation on that, and also representatives from the historic Saugeen Métis and the Métis Nation of Ontario.
Excellent. So in the last minute, and my list is almost completely answered, I'm wondering how you're doing. You've been working long hours, I'm sure. Are you keeping well, and are you getting rest, James?
Yes, but I've been still back on eating too much junk food. So I'm stuck in the house and eating cookies and junk food. And so time to cut back on those calories the next week. But no, things are great. The family is very healthy, and it's nice to be together and safe.
Excellent. I want to thank you for joining us here and providing this update. I think it's really important information, and I certainly appreciate your time.
Thank you.
Thank you. Thank you as well to our viewing audience for joining us today. Please join us again to learn more about COVID-19 and the community response. Take care of each other and stay healthy. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
that he fell.
Whoa, I'm not driving. I'm way too stoned. How are you feeling, Veer?
Since we had that toke, I'm not driving tonight at all.